Pediatricians from across Pennsylvania are at the state capitol for a day of advocacy and education. Our Mallory Messner, she is there. She's outside. She joins us live now in Harrisburg with more on what's being discussed there. Good afternoon to you, Mallory.
Good afternoon, James. The Pennsylvania chapter of the American Academy of Pediatrics is addressing how Medicaid cuts would impact children. The United States House of Representatives passed H.R. 1 in May. Pediatricians in Pennsylvania say if it becomes law, health care for children would be negatively impacted. According to the PA chapter American Academy of Pediatrics, Medicaid covers 35% of births in the state. It covers access to dental, hearing services. It provides care for children with special health care needs, things that private insurance does not cover. It also covers mental and behavioral care, even speech therapy in schools.
Medicaid cuts could result in more trips to the emergency room because parents may not be able to afford their child's asthma medication or insulin. We might even see an increase in absenteeism in school due to the loss of routine screenings and in vaccinations. These proposed deep funding federal cuts for Medicaid will not only limit patients' access to care, it will shift the cost to our state.
The pediatricians are also worried how Medicaid cuts could impact children's access to pediatricians and vaccines. We'll talk more about that tonight at 5:30, James.
All right, so Mallory, we were listening there as you were talking about what these pediatricians were there to address, and a lot of what they were talking about was on the federal level. Was there something that they were saying that the state level could do to help fix this?
They were saying that a lot of the funding is sort of a joint effort between the federal and state government, and a lot of the funding would fall back on the state. The state would have to act to keep some of those health care programs for children if the federal funding cuts were made. So they're advocating for state lawmakers now, ahead of time, in case those Medicaid cuts do happen.